Doing? I hope everyone is doing well and have had a wonderful weekend so far. My name once again is Dr. Nze Akano. I'm the president and the founder of Nze Timothy Akano Foundation. So today we want to talk about the male factors that cause infertility, the issues of men in relation to infertility. Like we know already in our culture, in our environment, when a woman hasn't taken in, a lot of people blame her. Nobody blames the man. They call her the witch. They call her barren. He married a man like himself and all that, not knowing that the problem may be of the man, from the man, because like we have advertised, up to 40% of infertility cases are caused by male factors. What it means is that the problem why the woman is not taking in is due to problem from the man, not from the woman. So before we go into the nitty-gritty, I like to define infertility, or what we also refer to as subfertility. So before you can say a couple, because when we're talking about infertility is not a man or a woman, is a couple that are infertile, not the woman that is infertile, because we don't know where the problem is coming from. So infertility or subfertility means that the couple haven't been able to become pregnant in up to 12 months of regular unprotected sex. So when you mean regular in this context is having sex up to 2 to 3 times a week. That is what regular sexual activity, unprotected sex. So the couple would have been having sex up to 2-3 times every week for 12 months, and if the pregnancy didn't occur, then they will be the condition is not defined as infertility or subfertility. So it's not a case of a couple maybe tried for 2 months and they said they're infertile. You have to be trying often for up to a year before infertility is diagnosed. So that is what infertility is. There are a few terminologies that I will be using in this lecture. So I will need to, there are terminologies that I have used several times, but I will need to explain them again so that those who don't remember, or those who were not in the lectures, or those who don't know what these terminologies mean would flow with us. So the first thing is semen. There's a difference between semen and sperm, spermatozoa. There is a difference between semen and spermatozoa. Semen is that fluid that the man releases after ejaculation. That is semen. And semen contains 2 things. So the semen contains prostatic fluid and spermatozoa. So the prostatic fluid is made by the prostate. The same prostate that men do have the cancer of prostate that you know about. So this fluid actually helps to lubricate the spermatozoa and help it in its quick movement, while the testicle, produces the spermatozoa. So a combination of 2 of them is what we refer to as semen. So when a man ejaculates is releasing of that fluid. So when a man ejaculates, what he ejaculates is semen. So when the semen is ejaculated, it goes through the female, the vagina, and swims through the womb, and then goes to the tube. Like I've said in my previous lectures, every woman has 2 tubes, left and right. And this tube is where fertilization takes place. Fertilization is the process of the sperm and the woman's egg meeting together to form a baby. That's what fertilization is. So you also need to be reminded of what ovulation is. Ovulation, okay, on top of your fallopian tubes are your ovaries. As you have 2 tubes, you have 2 ovaries on top. So these ovaries are the organ that release hormones as well as release the ova for plural and ovum for singular, the same thing as egg. So when the ovary releases the egg goes down into the tube and stays there, and the sperm that came through the vagina would mate with the egg and form a baby. This is what is referred to as fertilization. So when the baby is formed in the tube, the baby stays in the tube for about 1 to 2 weeks, and then swims and moves down into the womb and gets attached to the wall of the inside the womb. This is the process known as implantation, and then the baby stays there for the 9 months. So anything that affects any of this process, release of sperm, to swimming of the sperm, to the fertilization, to ovulation, to implantation, will lead to infertility. Anything that affects it would obviously lead to infertility. So, excuse me. By way of statistics, just to put it out there, 84% of couples who try to have a baby after having unprotected sex for about 1 year, 84% actually succeeds. 84. It's only 16% that don't succeed. So out of that 16% that don't succeed, within the next 1 year, 50% of them succeed. Then the next year, 50% of remaining will succeed. So in 3 years, most of them would have taken in. And another thing is that obviously fertility of women is related to age. So when the woman passes 35, the fertility starts declining. That doesn't mean that the woman cannot have children, but obviously it starts declining. It's not the same thing as the fertility of a 20 to 25-year-old woman. So this is and infertility as a problem is a major problem. It affects about 14% of all couples. So about 14% of all couples have issues of infertility at one point in time in their life. Okay. So this is what infertility is. Then let's talk about quickly types of infertility. There's primary infertility, which means that the woman has never taken in and the man has never impregnated the woman. That's primary. The man has never impregnated the woman and the woman has never taken in. That's primary. Why secondary is maybe the woman has had a baby before and then struggles to be pregnant again, or the man has fathered a child before and struggles to, that's secondary. Usually, most of primary infertility, most of them are due to problem from the man. Primary, where the couple, none of them has taken it, it's normally from the woman, while the secondary is usually due to the woman, a problem in the woman's tube. Maybe the woman has had a tubal blockage or rupture or something. And then we also have what we call unexplained infertility. This unexplained infertility means that the problem has been investigated, tests have been done, and no cause was found. And that is almost up to 20% of all cases of infertility, no cause was found. So we don't know why. It's just there and there, So by way of statistics, the male factors are up to 40%. And then there are some times where both the man and the woman have issues causing the infertility. That's about 20%. So you can see that actually the man is more predominant in the causation of infertility than the woman, despite the fact that the woman is the person that takes the brunt and is the one that is depressed and stressed and goes to churches and spiritual houses and does everything to be pregnant, while the man is sitting pretty. Meanwhile, the man is the cause of the problem. All right. So let's talk about quickly talk about the causes of infertility. We are going to be talking more about the male. Let me just quickly list some things that could affect infertility from the woman's point of view. So normally, like I said, if a woman has a problem with the vagina, or problem with her womb, or problem with her tube, or problem with her ovary, or she's, aging, or she's so obese, overweight, over BMI, body mass index of over 30, or she smokes a lot, or she drinks a lot of alcohol, she uses drugs, or she's stressed. These are some of the things that can cause infertility in the woman. Problem with the ovaries, problem with the tubes, problem with the womb, problem with the vagina, and self lifestyles. So let's go to man. So what are the reasons why a man would be infertile? We also look at the male organ. First and foremost, for a man to be able to fertilize a woman, he needs to have an erection. So if he has a problem with erection, which we call erectile dysfunction, or in layman's time, impotence, he's not going to be able to, do the job. So that's one, erectile dysfunction. There are some people that also have what we call retrograde ejaculation. So what it means, ejaculation is release of semen. So retrograde means instead of the semen being expelled out into the woman's vagina, the semen goes back and then goes to be deposited in the man's bladder inside. So instead of coming out, it's going back in. It's not harmful to the man, but obviously the sperm is not going into the woman's organ. So there's no way for them to fertilize, because it's going back into the bladder. So it's due to problem with bladder and that causes that. So I've talked about erectile dysfunction. I've talked about retrograde. Then what of the testicle itself? The testicles produce the sperm that fertilizes the egg. So if there's a problem with the testicle, like there's some boys who are born with what we call undescended testes. So the testes are still in the abdominal canal. The testes have not descended into the scrotum. So when those people are born, and if they were born in a good place where there's good medical facility, and they're examined and it was discovered that it's there, then they can be referred for the testicle to be brought down to the scrotum. The operation is called orchidopexy. It's done, and that testicle would function normal. But if it wasn't picked and is left there, that place is very, 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 very hot, or in that canal, so it will just kill the testicle. So the person will never, obviously, the person will not have testicles, and therefore will never produce sperm. So that's what we call undescended testicle. Some people also do have, maybe if you had cancer of the testicle, or you've had trauma to your testicle, or you've had an infection affecting the testicle like mumps, or maybe you had chemotherapy, around your testicles and all that. All those problems with the testicle would also cause male infertility. There is also something which is a very common cause of infertility in men, which we call varicose cell. It's like the veins that supply the testicles become very engorged. And then when you check the man's testicle, it's like he has a bag of worms there. So that's varicose cell. It causes, in fact, I think it causes up to 25% of male infertility. Also, use of anabolic steroids. Some men some sports people use these things to build up, to help their sporting activity. So anabolic steroids can also cause instability. People that smoke cannabis and use cocaine. Sorry. Yeah, sorry about this. I wouldn't say it's Nigerian factor. After all, it happened also in UK once. So, can see I'm, you know, I feel happier in this video because I'm at home. So, sorry about the break in transmission. So, I was trying to, and to tell you the causes of infertility in man. And then there are some men that have some genetic or chromosomal problem that we call Klinefelter syndrome, So if they have that, they won't be able to produce sperm, So also the lifestyle also affects men like it does affect women, like if you a smoker, heavy alcohol user, drug user, if you are very obese, if you're stressed, these are some of the things that can affect and cause infertility in men. And also, you might be on medication for other conditions like rheumatoid arthritis. There are some medications like sulfasalazine that if you're taking it, it can cause infertility. So there are a few things that can cause infertility in men that many people, don't know. So when a couple have not been able to become pregnant in 1 year, my advice is to investigate from the man. It's easier to investigate from the man because some of the investigations that the woman does are quite invasive, quite painful, quite, very, very invasive investigations. While the investigations that the men do are very simple and that can, diagnose the problem quickly. So if they are infertile, the first test they will do, obviously, the doctor will examine the man and send the man for sperm test. We call it seminal fluid analysis. For that test to be done properly, it needs to be done properly. The man has to abstain from sex for at least 2 to 3 days. He has to abstain from sex and then use a clean pot, and then masturbate into the pot, and that sample needs to get to the lab for examination within the hour. So if the man lives very far from the hospital, so we advise the man to go to the hospital and masturbate there. So if you masturbate within the hour, the sperm will be looked at. So what are they looking for in the sperm? That can give an idea of what's going on. So they're looking for the sperm, they're looking at the volume of the sperm. They're looking at the sperm count. They're looking at the types of, how the sperm looks. They're also looking at the activity of how quickly the sperm move. They're also looking at how, whether acidic or alkaline the sperm is. They'll sometimes also look at what we call white blood cells or leukocytes, how much are in that sperm. So there's a standard for something like the volume. The volume is expected to be at least 2 to 5 mils. 5 mils is like 1 teaspoon. So the sperm volume should be up to 2 mil to 5 mil. Because the fact is that if the volume is not enough, then the chances that you have enough sperm to fertilize the woman is low. It doesn't mean that if it's low, you won't be able to fertilize, but it reduces your chances. Then the sperm count, depending on the country where you live. In the UK, we say the sperm count, the normal average sperm count is 75 million in 1 mil of sperm. There should be up to 70, that's the normal, 75 million in 1 mil. But so when it's less than, in the UK, if it's less than 20 million, we say that's abnormal. And that is what we call oligospermia. Oligo means small, something less than it should be. So if it's less than 20, but I think in America they use 15 million. So let's say if the sperm count is less than between 15 and 20 million per mil, just one, little mil. So in 1 little mil, there are over 75 million sperm, even 100 million in it. That's more 1 mil. You know, so if your own is less than 15 to 20 million, then is oligospermia. When you have oligospermia, it reduces your chances of fertilizing a woman, even though it's just one sperm that is required to fertilize a woman. But the fact is that the more sperm you have, the more your chances of fertilizing a woman. So if your sperm is less than 15 to 20 million, then you may have a problem. I'm not saying that people that have oligospermia don't fertilize the women, they don't have babies. They can have, but they are not as fertile. They are not as prompt as people that have sperm of over 20 to 100 million per male. We also look at active. So when they look at the sperm, they look at what percentage of this sperm is active. How many of them are active? You know, how active are they? So if your sperm is up to 50% of all the sperm in that one male, or that quantity that you produce, if 50% is active, that they move quickly, you know, then that's fine. But if less than 50 are sluggish, you know, then your chances of fertilizing a woman is also low, because your sperm contains a lot of sluggish spermatozoa. But if more than 50% are active, you know that obviously they are very busy, they are dutiful, so they will just swim. You know, activity, you know, they swim, you know, like, you know, and then go. So we also look at morphology. Morphology is how, you know, like the sperm will have head, neck, tail. So there are some sperm that are deformed or not properly formed. So what percentage are like that? If the abnormal percentage is up to 50%, then that can also affect the chances of fertilization. Do you understand? So these are some of the things that they look at in this, you know. And then the advice is that if the man did the seminal fluid analysis and it was abnormal, he's advised to repeat another one in about 4 to 6 weeks, because sometimes some, you know, bodily issues and factors can affect the count. So you're asked to do it again. So if you do it again and it's still that low, then or is abnormal in count or activity or morphology, or, you know, then that's the problem. Then there are also people that don't even have any sperm at all in that fluid. They produce the semen, but there is no single sperm there. That is called Esospermia. Maybe there's a blockage. There's a blockage of the channel, the tube that you know, sends the sperm from the testicle into where it's stored, is blocked. So there is none. When they release semen, what they have there is only the one from the prostate, none from the testicle. That's esospermia, no sperm at all. So such people will never be able to fertilize a woman. But obviously, we'll talk about treatment in a minute. So these are the then apart from the seminal fluid analysis, some of the tests that the man does is, you know, they will check for his testosterone. Testosterone is the male sex hormone that is produced by the testicles, that is responsible for production of sperm. So there are some people that do have what we call hypogonadism, is the name of the disease, and they don't produce enough testosterone, and therefore they're not producing enough sperm because of this hormonal issue. Maybe because they had cancer before, or because of the treatment they had before, or because of the drugs they were using before. So this is one of the causes of male infertility that can be helped. You know, if they do have that hypogonadism, they can be prescribed that testosterone to see whether that will boost the quality of their sperm. You know, so okay, so let's talk about treatment. You know, the problem is that a lot of people that do have oligospermia, you know, they've gone to do seminal. Okay, I forgot to know. Apart from the testosterone, you also do 2 other hormonal tests. You know, follicle stimulating hormone and luteinizing hormone. These are also sex hormones, you know, that are predominant in the woman, but men also have them. So they check all that. So these are the four: seminal fluid analysis, testosterone level, follicle-stimulating hormone, and luteinizing hormone. These are the hormones that they check. And then if everything is normal and they are not still, if the couple are not becoming pregnant, then emphasis will go on the woman to, obviously investigate and see whether there's any issue. So how do you treat the men's problem? I think the treatment depends on what is causing these issues. But the fact of the matter is that, treatment of male, especially oligospermia and all that, is not very easy. It is not a walk in the park. It's not something you go to the doctor and you prescribe medication and everything normalizes. I mean, obviously, if you had infection like chlamydia or gonorrhea, I forgot to mention, chlamydia, gonorrhea can also cause problems with the tubes and then cause oligospermia. So if you had all those problems and they can be treated, if you had obstruction, blockage of tubes, those can you can have an operation to open up the channel so that the sperm can flow. If you had that varicose cell, that bag of worm that I mentioned before, you can the man can have an operation and then to correct that, and then the man can become fertile again. If the man suffering from retrograde ejaculation, which is the condition whereby the sperm, instead of coming out, goes into the bladder, there are some medications like imipramine and all that can prescribe that do help, so that the sperm will now go the right direction. There are medications for that. So there is no one treatment for male infertility. It depends on what is causing it. But most of these things is what we call they're idiopathic. Idiopathic means nobody can find why this is happening to the man, and there is no form of medical or surgical treatment that will help. In these situations, we start advising the man to go for assisted reproduction, like IVF, IVF, in vitro fertilization, where the man's sperm will be, and the woman's egg will be fertilized outside, and then when the baby is formed, they now take it to the womb and deposit in the womb to implant. Or, there are also other ones, intrauterine insemination, different assisted reproduction. That's what we advise, because there's no medication. Because I know that men, they go to the doctor will prescribe this, prescribe that, do this. Sometimes they say it's staph that is causing it, staphylococcus, the man will be spending so much money and the problem still persists, So it is not usually easy to treat it. But if the cause is identified, like varicose cell, like I mentioned, or obstruction, if the person has erectile dysfunction as an impotence, there are things that can be done to help the person have a bit of erection. There are medications, there are other means to help, person to have an erection and deposit sperm, because all they need to do is to deposit sperm. But I mean, if you can masturbate, into a condom or into a container, the sperm can be introduced into the woman's vagina. Or they can go also and buy, go to a sperm bank and buy sperm, and then use it and fertilize the woman's egg, and they have baby. So there are so many ways of doing it, So this is, I just wanted to summarize in a nutshell. I didn't want to talk too much today, because I just came back today, so I'm a bit tired. And then obviously, the couple or the man will be advised to stop smoking, to lose weight if he's obese, to do light exercises, eat healthily, stop hard drugs, like cannabis, marijuana. You'll be, if he's stressed, he'll be asked to try to do things to distress himself, because the more stressed you are, the more it affects your fertility. There has been some hypothesis that wearing warm undies, also affects fertility. That's a little bit, is neither here nor there. It's been argued, but it's always advisable to wear and boxers that at least you can have air get into your beats so that the temperature will not be high. The testicles don't do well with high temperature. So, some people that also work where the temperature is high, they're advised to, from time to time, to go and take a break so that they can have air going in there. So these are some of the, reasons why a man can be infertile. And I can assure you that a lot of the infertility are due to the man, not due to the woman, especially the primary one, So if you're married or and then you guys have issues with, by all means, let the man go with you to see your doctor, and then let the investigation start from the man, And then if the man is fine, then you can do all the hysterosalpingogram, all the scan, and all the blood tests that they do to, even operations, laparoscopy that you do. The woman's own investigations are invasive. Operations, injecting dye into the womb, that is very painful and all that. So that is it. I will see whether you have questions, because I don't intend to stay long, so I can go and sleep. What's the time? So I've done like half an hour. So the next 15-20 minutes, I should go and sleep. I didn't sleep very well last night. So obviously, when you're on board, you can't sleep. Let's see what our few guests are asking. At least the men would know that, they will know to go and check themselves up if they are not, in Africa, there's so much ignorance. The moment the woman hasn't taken in, automatically, everybody believes the problem is the woman. Everybody, where the woman is fine. So, let's see. It is advisable to wear cotton undies and boxers, correct? A little bit, to reduce the temperature of the testicle. Nadia, there's a sperm bank, of course. There's sperm bank and there's egg bank. Where, some people store their eggs. Yes, you can go and buy eggs. You can go and buy sperm. I don't know whether it's in Nigeria. I'm not sure, but is it? Yeah. So there's sperm bank. So anybody that has problem with sperm production can just go and buy sperm. If a woman has problem with ovulation, they can go and buy egg. So the world has moved on. You can't kill yourself trying to have sex every day to see. You can imagine how it feels. At the end of the month, your wife says, "Oh, I've seen my period again." Then you continue again. "I've seen my period again." It's very traumatic, isn't it? Chisom. Hello, Chisom. I'll call you back, okay? So, there are so many things one can do these days, apart from the assisted, you have adoption, you have surrogacy, I don't know whether they do surrogacy in Nigeria. Surrogacy, for those who don't know what it is, you pay a woman to carry the baby for you. Maybe if the woman has a problem with her womb, then you pay another woman to carry the baby, and then when she has the baby, then you take the baby from the woman and pay her money. That's surrogacy. A lot of people do it. So there are many things you can do, and then the egg can be yours. The sperm can be your husband's own. So the baby is yours. All the woman did was just to carry the baby for you. The man doesn't have to sleep with the woman. All they need to do is to take her egg, take your egg, take your the man's sperm, mate outside, IVF, form a baby, and introduce it into her womb, and she carries it for you. So there are many things that can be done to have a baby. They are all biological. I'm looking. Esospermia. Yeah, there the esospermia, there's 2O, AZOO. So no sperm at all in the fluid. The person releases fluid, semen, but semen without sperm. So that's only prostatic fluid that the person is releasing. Esospermia. So that person can never impregnate a woman. If it's less than 20 million in a male, it's called oligospermia, yes. But some countries use 15, but UK uses 20. But an average man, each time he ejaculates, he has up to 75 to 100 million in 1 meal. Wow, just 1 meal, 100. God is great. 100 million spermatozoa in 1 meal. 1 meal is, 1 meal is, like teaspoon is 5 mil. 1/5 of a teaspoon is 1 mil. You know how little that is, and that contains 100 million sperm. Sperm is spermatozoa. Yeah, the champion sperm will now go and fertilize the. Yes, Abarachi, yes, average sperm will be about 75 million. That's average. But some people have, 100, per meal. Yes, that's a very good question. If the person cannot masturbate, then the seminal fluid analysis will not be clean. Because if you do it, how else will you get it? From during sex? So you might be contaminated, withdrawal method, that's what you're talking about, that when the man is at the height of masturbation, then you pull out and pour the sperm into the container provided. That is not as clean and accurate as masturbation, because masturbation is just, you clean your penis and everything, then masturbate, and so if, for example, you had sex with somebody, you might get infection or contamination and things like that. So, I don't know. Masturbation is a problem sometimes, I understand. It's a very pertinent question, but that's the best way to do it. So anybody that has that problem would have to go and learn how to masturbate. What's happening here? It looks like, who's this Judith Fred? Is she fighting with somebody? I don't get what's going on. Hey. There's somebody disrupting the session. She's talking about being removed and how boring the group is. I don't know who she is. Yeah, she's just disrupting, and I don't know why people are listening to her. They should have just ignored her. Yes, Fola, you listed it, but varicose, not Viagra. It looks like you were thinking of Viagra. Varicose Cell. VARICO, then COELE. So it's not something you can spell if you're not medical anyway. But you did well as usual, as my best student. Okay. They said I have questions, but they have removed me from the group. But you're there. How did they remove you? Tell me. They removed you now. You can ask the question here. Who removed you and when? Yeah, I don't think I'll save it after. I will look at the questions. Okay. I'll read and then I'll answer. I need to, I think I slept only for 1 hour or two on board. So I need to sleep and get myself. All right, guys. Thank you for being here today. I'll see you guys again. Good night and God bless you.